So good evening, everyone. So I thought I'll not use slides so that I will save 5 minutes, right? And I know many of you have to take flights. I have a very easy, but one of the most difficult topic to talk about, which is about patience, right? There's a book called Putting the Last First. It is written by Robert Chambers, and it's a beautiful book which talks about putting the last first. And in the same way in healthcare, we talk about everything, but many times we miss patience, right? You will not find a company which will say that patients are not at the core or at the center. Every service provider will say patient is at center, patient is at our heart, patient is at our core, right? But we know there is a subjectivity attached to it. I'm not generalizing it, but there will be one hospital, one doctor, one institution, one company which will be more patient-centric than other. And it's a journey. It's a journey where we all, in any industry we try to cover that journey to become most patient-centric organization. I have a picture which I have not put it, but if you imagine the table where you are sitting, imagine that people sitting around the table are all stakeholders, right? It may be doctors, it may be physicians, pharmacists, pharma company, and that beautiful flower which is in the center is a patient, right? And what happens many times, that patient remains there and everybody is engaging around that patient. But that flower is just silently watching everybody, having an engagement. And that's why it is very important that this beautiful flower which is there has to speak. More than the flower speaks, we have to allow this flower to speak. In our healthcare system, we have to think, and I think if one message we all can take it from here, are we doing enough to allow that flower to speak? Are we doing something to engage with that flower? Otherwise, that flower will be there. When we all will go, somebody will pick it and again bring it back for some other conference. And why I am saying this, because for last over a decade, I have been working with a lot of patient organizations. Maybe 15 years back, I was also not having the same belief on the power of engaging with patients in our business or in our whatever thing we do in healthcare. Because patients, as Mr. Sanchit was talking before me, is patients have become digital patients now. They are not only patients, they are digital patients. Because they are connected. They are connected more than ever now. And when they are connected, in our country, when the average OPD time, somewhere it may be in minutes, even in some of the medical college, it may be seconds. Somebody was saying that when a patient walks, a doctor sitting in a medical college watches that patient and guess, कि इसको ये हो रहा होगा. Prescription चालू हो जाता है. And by the time patient comes, 2-3 सवाल पूछे, चले गए. और बाद में patient बाहर जाके सोचता है ये तो बताया ही नहीं मैंने. But डॉक्टर साहब ने पूछा भी नहीं. So in this case, this whole communication between patient and between the healthcare provider is missing. It is not everywhere. That if you go to a corporate hospital, यहाँ पे I get 15 minutes or 20 minutes for a conversation. Because of the sheer load that the doctor has in a public healthcare system, it is not happening. And that's why many of these patients, then they go to other patient support groups or peer groups, where they try to find solutions. And we have many such models. What I wanted to highlight is that they are not the passive participant. They are not the passive participant. That means कि हमने कुछ भी लिखा वो लेके चले गए. They will ask questions. When we ask questions, do we appreciate them asking questions? Do we encourage them asking questions? I had, when I have asked in my personal capacity certain questions, it was not appreciated. I asked that, they say, no. So, because there is a power equation. There is a power equation between provider and person who is getting the service. And in this power equation, patients may not be at a same level. Which may not be true, because nobody else understands their disease better than that person who is living with that medical condition. But do we do that? These are some of the questions. We are not here to come up with a solution, but do we give that enough in that power equation? And we have to give that power to the other person and listen to that person. If we listen to them, maybe the outcome what we talk about will be much, much better. Patients will have a choice. We talked about many other therapy, different things. Does any cancer patient go, somebody talks about stress? I don't think that in a hospital somebody will discuss about that topic. But these are all options that our patients need to get. Now, who are these patients? We all are patients. It is not that patient is somebody else. They are also one among us. There is a patient within ourselves. In this room, except a lot of young people whom I see behind, if people who are sitting on the round table, if I ask, how many of us, any therapy? How many of us are not on any therapy? At the end, we will say this, hum bhi bimar padte hain, we are on some or the other therapy. So we all are patients. At the same time, we are all also service provider. But ये जब role change होता है, it becomes very different. I am part of many support groups where somebody who has been a physician, who is a physician, is also a cancer patient. Now his way of looking things is very different. There are doctors who have experienced this disease very closely, whether by himself or herself or somebody in very closely family. The way they used to practice changes. So what I mean to say that it's not only about empathy, it's not about sympathy. First is acknowledging that patients are not passive, they are active participants, right? There are numerous examples in our country. I will just take one or two very short examples before I close. There is a rare disease called spinal muscular atrophy. Many of you would have heard about this disease. A group of mothers, so this is a disease which impacts children. So the mothers who were impacted, they came together, somebody from South, somebody from East, somebody from Mumbai, and they formed a group called SMA Warrior. And they registered this group few years back, 5 to 6 years back. And they wanted the comprehensive care for this disease, not only treatment, but screening and everything. You will be happy to know, as on date when I speak, because of their children, and it's all mothers, exclusively mothers group, they went to High Court, and they have an order from Government of India that 900 crore rupees has to be allocated for treatment of rare disease in India. It's only power of these women. This means people who have been impacted by the disease, because nobody will be more credible than asking for this. They have been given. The other example is there is a disease called sickle cell disease, if you know. It's a disease of which is mostly prevalent in tribal areas. Not many people talk about it, right? There has been no treatment for this disease in many, many decades. Now there are few treatments which is coming. Otherwise, the only treatment they had was hydroxyurea. That itself was not available. So sometime when we talk about access and everything, it's not money. Even a 10 paisa in Nagpur, I remember patients used to come from nearby places where they used to spend 300 rupees to get a drug of 10 rupees because they don't know the value of that. Now these patients, 3 to 4 years back, I used to work with a company that time, and we started working with this group. Lot of patient leaders, people who were impacted, they came together, they formed an organization which is called NASCO, National Alliance for Sickle Cell Organization. The impact is 2 years back, Government of India launched a sickle cell disease elimination mission. They said that by 2047, when we will become, will celebrate this, nobody with this disease should born, right? There are numerous power, but this all happened because everybody, people sitting here, all of us have given them that seat. Policymakers have invited them to understand what you need. Physicians have understood what they need. So all the stakeholders have given them that ear, that voice, and they could do that. I don't want to speak more on this. I think this is just a request, belief that I wanted to share with all of you is, again, patients are not passive. They are active participant, provided we allow them. Provided we leave those seats. There are a lot of seats we occupy as experts. We always feel we know about this disease better. Only thing I remember, a lot of time we do doctors advisory board. A lot of organizations now do patients advisory board. And one of the patient advisory board, a disease which was elderly disease, elderly people came and he said that you have made a very good education material, but who makes this? Because the font size is only 8. Right? He said, consult us. When you are making something for us, nothing about us without us. when you will make a font size 8 material for a 70-year-old person, even with specs, I cannot read it. Next time, the same company increase the font size to 18. The acceptance of that material gone high. So there are numerous examples where we really listen actively, things will change, and ultimately the aim is for the sustainable healthcare. That will sustain unless and until we start listening to them. So thank you so much for your patient listening. Thank you.